Well, the country's mental health facilities have long reflected a historic legacy of social exclusion, disempowerment, stigma and discrimination. Now, with the president's order to establish an ultra-modern national mental health hospital and also elevate the Mathari National Teaching and Referral Hospital to a semi-autonomous specialized hospital, what does this bode for the future of the country's mental health? Well, NTV's Ngina Kirori explores.
Kenya suffers a huge mental health burden and is ranked 5th in Africa in cases of depression. Psychologists have a diagnosis of the poor state of mental health in Kenya.
The result of this ignorance is that right from the top to the bottom, there have been a lot of missteps. At the top, when people are making policy, historically, even health policy has had very little by way of mental health contribution.
The Mathari Teaching and Referral Facility, which was started as a smallpox center and then converted into an asylum during the colonial days, has been the ugly face of the country's mental health struggles.
The beacon of neglect of mental health in this country has been Mathari Hospital. The structure was built in the 20s and has remained as was built in the 20s, with a few additions in the 70s until today. It's a place where, I mean, if you're admitted as a patient, you would be right to feel like you're being jailed.
For long, efforts towards addressing the country's mental health have often taken the back burner until President Kenyatta elevated the Mathari Hospital to a referral facility. But what does this now mean for the facility and the future of mental health in the country?
So within the first 3 to 6 months, you will see improvements in the care of patients. You'll see some improvement in the aesthetics of the hospital, where when you go in, it should feel like a place where people come for care rather than to be imprisoned.
The coronavirus pandemic has already taken its toll on the country's fragile mental health.
So after the second week, after we had our first cases, I found myself starting to have very negative thoughts. And these negative thoughts were in line with what's the point of living if corona is here.
But the infection itself affects the brain. And so there will be people who will have long-term psychological and neuropsychiatric consequences as a result of being infected.
An investigation by the Senate in 2018 revealed that deep budget cuts had affected the quality of services offered at the facility. The president's action may just be the much-needed shot in the arm for a country weighed down by its mental health struggles. Ngina Kirori, NTV.